Welcome to NewsNation. Thought she was having a seizure there for a second. Good thing. I hope she has good health care. So this is where right and left come to be reasonable. As Liz and I were just talking, the two parties both presented competing plans in the Senate today for a vote on ACA subsidies. They both knew their proposal would fail. They're fine with that. Neither addresses the real problem, and they all know it. Now, the first real problem for us is, did this impasse, did the fact that it's a charade, that it's a farce, did that get any attention? No, it's not in any of your trending lists. You know how a quote can stick with you in life? News is what the people in power want to stay hidden. Everything else is just publicity. It's an old adage in journalism. Bill Moyers, legend, referred to it in a speech some 20 years ago, and I remember it like it was yesterday. His son, by the way, has done an amazing job in the addiction and recovery space. Great family, helping people understand the world around them. What is trending today? What the powerful want hidden is not there, right? A grand jury failing to indict the New York AG. Good. Failing or refusing, depending on your perspective, right? Trump's health and his protests that he's in A+++ shape, just like the economy. Wanting to audit the Epstein files before their release. Hostilities and hot talk with Venezuela. The latest on going after Senator Kelly and Homeland Secretary Noem. None of these makes a bit of difference to you and your family. Not in terms of what matters most. Not in terms of what shapes your dreams or what is an obstacle to the same. Metaphorically, they are each and all the smallest animals in the jungle. Meanwhile, the elephant is there for all to see. Not access to health care, not the ability to get health insurance, but the real devil behind those details. What this country allows multiple layers of greedy corporate actors to charge the rest of us for what matters most. The problem with health care is and always has been cost. People are more bothered by the price of cigarettes and how much a Big Mac is than they are by the cost of health care, when it is crippling families in their time of need all across the country. Even the president's Affordability tour, which I am a big fan of because I want that front and center so I don't have to talk about whether or not his rallies are racist or whether or not members of his administration are secretly gay or any other clickbait that you guys decide to be turned on by. At least he is nominally talking about what matters more, right? This matters more. How much attention is he giving to healthcare cost? Very, very little. He has harsh words for the people responsible. I like that. He sees the greed. He sees the lobbying, but he also sees the leverage. So he's not really taking that on. He's going to take on the Democrats. He's going to take on Biden. That's easy. Why? Because there's advantage in that. He's not going to make any advantage taking on the cost structure. No way. It'll crush him. But not here. Not at NewsNation. This is why we exist, to talk about what they don't want to expose. They shut down this government over their health care subsidies, which are just a symptom, okay? Millions of people suffered for weeks for this supposed noble cause. And since then, you haven't heard a word about it, except these two failed votes today, right? And all they're really doing is saying that the other side's to blame for it. Why? Look. They can't take on this power structure. They can't do it. I'll explain it to you, all right? These guys that I'm showing you right now, Hakeem Jeffries, Chuck Schumer, Senator John Thune on the right, Speaker Johnson. Google how much money they've taken from the health care. PACs. Well, there's no real coordination with the campaign. Look at the millions of dollars they've gotten. So the left's idea is extend the subsidies. Good. Help people pay. Doesn't do anything on costs. The right says, oh, we're going to put it into your own account. That's not going to affect costs. Hold on. This is all about Band-Aids on bullet holes. Okay? You having your own account sounds like control. It's the illusion of control because it has nothing to do with how much you have to pay for that thing. It's just the mechanism of payment. You see what I'm saying? Both sides, what do they want? They want answers or solutions that don't touch the real problem because they're afraid. The solutions to address their problem, which is really one problem they both have, they don't want to take on the corporations driving healthcare costs. In the last decade, healthcare spending is up 75% in this country, double the pace of inflation. Millions of Americans with health insurance are in medical debt. Why? Greed. That's not true, their army of lobbyists will cry and drown me out. Our margins are very small. We have great outcomes. If the margins are so small, why has executive pay in the industry increased just as rapidly as the cost structure? Why has stock price been among the top performers? If the margins are so small, if it's such a bad business, if it's almost a charity. So while they get rich and their stock prices surge, because that's all they care about, there has to be a loser. So who's going to lose? You. Over 100 million Americans say they have medical debt. 100 million. Medical debt is literally the single largest share of all consumer debt. 1/3 of those with that debt say it impacts their ability to afford food, rent, and utilities. Oof, boy, we should have added this to the 4 freedoms. Right? What is more basic? It's not just the poor and the uninsured, because that's what they're going to do, right? They're going to tell you it's the poor. It's Medicaid. It's Medicaid that's killing you. It's those people on the food stamps. If it weren't for them, BS. Nearly half of adults who make $90,000 or more than 6 in 10 with insurance, have medical debt. You want me to say it again? Overwhelming percentages, okay? 45% of those making over 90 grand. One study found in just the last decade the impact of employers passing down health insurance costs because they can't keep paying it as it goes up and keep their margins for their shareholders has actually depressed wages. They're paying you less because they have to pay the rich healthcare companies more. Someone's got to lose. It's you. Many argue with me about this. Oh, don't make affordability all about health care. It really isn't. You have mortgages, you have rent, you have food, you have wages, you have energy. Yeah, okay. Here's why I do it, okay? Because it's not like I don't care about the other things. The job is to care on what matters most, and this is it. Brookings, conservative, 1975. Since then, healthcare costs had the same impact on income inequality in this country as shipping jobs abroad, as automation, as cutting jobs here as part of corporate contraction. Each of those that we talk about all the time, right? China, China, China. Domestic healthcare companies have done us just as dirty as they have. In terms of just raw dollars, if the healthcare, let me say this slowly. If the healthcare sector were its own country, it would be the 3rd largest economy in the world. Let it sink in. Healthcare spending is now almost 20% of our GDP. Healthcare companies represent 15% of the stock market. It is dominant. How'd they pull this off? Paying the watchman. For all the talk of draining the swamp, the healthcare sector is the single largest lobbying sector. And I'll tell you why that's true. They'll say, no, it's the banks, it's the finance sector. Hold on. Here's why that's not fair. Because the finance business has so many products and sharing with the healthcare lobby. Insurance, reinsurance, securitizing of debt and of policies, trading their stocks, using them in derivative instruments. They're interwoven. The sector by itself gave almost $1.5 billion in 1 year. Both sides say they're going to take on the donor class. They are lying to your face. The healthcare sector is consistently filling pockets on both sides. And let me tell you, my brothers and sisters on the left, I love the No Kings rally. I love the idea of going after why we've gotten so top-heavy in this country. It didn't used to be this way. There are a lot of reasons for it. But let me tell you, you guys take the most money from these people. 2/3 of the lobbying money from the healthcare industry goes to Democrats. You wonder why Hakeem Jeffries and Chuck Schumer are all about the subsidies, but not about reducing costs. Notice how quiet Senator Leader John Thune and Speaker Johnson are. Look how much money they've gotten from the same pocket. Look, Bernie Sanders has not taken money from the healthcare people, okay? He is pitching Medicare for all. Why? Because it is a simple solution to a complex problem. And still, it makes him ahead of everybody else. I'm telling you, he does not. Look at his website. Look at him from when he ran for president. Look at any of his interviews. He has no clue how to make Medicare for all work. And I'm not disrespecting the senator. I love him. I think he's great for our democracy. Okay? I really do. A slogan is easy. Medicare is not simple and not cheap. Premiums are going up for people on Medicare, too. And Medicare keeps expanding plans and layers for a reason. Because it's not just what this behemoth gives, this healthcare virus, this monster, okay? It's what they threaten to take if you mess with them. Oh, you want us to cut our costs? Okay, there goes access to hospitals and clinics in rural and lower income areas. They got to go. Got to get rid of them. Sorry. Oh, and the jobs. Got to cut the jobs. How many jobs, by the way? It's the largest employer in the country. 1 in 8 are in a job tied to the industry. There is not a single swing district that wouldn't be decimated if healthcare pulled out. They know it. They make sure the lawmakers know it, and they live it. Haven't you noticed that while the right will bash Obamacare as having made these guys rich, they won't do anything about the richness? Don't you think that's strange? That they won't do anything to attack what is really driving the costs? They'll say they're ready to die on the hill of subsidies. This is the right fight. Don't be weak, Fetterman. What was Fetterman saying? Hey, why don't we do something about the costs? If we're going to shut down the government, why don't we shut it down over the costs, not the subsidies? He was right. They just keep throwing. A subsidy is just taking my money and giving it to somebody else who doesn't have as much money to pay these people who won't change what they charge. You see what I'm saying? And now we have a media and digital media where they'll make anything else a news item rather than deal with this. You see what I'm saying? This is how big it is. This is how obvious it is. The only way this system really works is the way it's working for me right now. So I get this sinus infection, right? I've got this high, I pay the most from a group insurance with a massive group, a massive pool, Nexstar, the largest holder of television companies in the country, beautiful company. I got great insurance. The doctors I'm using that have me on air right now when I could not speak this morning, none of them even discuss insurance with me. None of them take it. The system works for me because I can pay my way. And that's not the way it's supposed to work. My ability to reach in my pocket and pay, then what the hell do I have an insurance policy for? You see what I'm saying? It would be grotesque if we were talking about paying for pizza, let alone paying for what we need most when times are the worst. And that is when they go after these people. Did you know that charitable hospitals, that a significant percentage of care that they deem charitable, do you know what it really is? It's when they've chased you and bankrupted you and worked you dry and can't get another cent that they then write off what they couldn't get from you as charity. I know it. I won awards for reporting it. Nothing has ever changed. That's what should kill you about this. That is what should make you desperate for a man or woman, I don't care if they call themselves a cantaloupe, who wants to take on the structure of cost. And it's all right there. It's the layers of administration. It's how they're able to set the markets. I'm telling you, they know the answers. They're afraid of this. If this is what we were talking about, this country would change for the better. Because let me tell you something. There are a lot of things that are unfair in this world, okay? Nothing comes before this, in my mind. Because we're dealing with people. When do you need this, okay? Because it's just hit the fan, right? That's why you need this. Checkups, sure. Checkups, great. Preventative health, great. But we've all heard the story, right? Oh, yeah, Pop got out of the hospital, and we got a bill for $250,000. We got a bill for $600,000. Oh, the baby had that weird thing when it was first born, had to stay in 3 days, and we got you've heard these stories. You may have had them yourself. Where does that number come from? Because they're in control of the system, right? They're in control of that system. And let me tell you something. Medical debt, not dischargeable in bankruptcy. Oh, I wonder where that came from. Okay? This should be unacceptable to all of you. It should be all you want to hear from your potential leaders. Not just from a financial perspective, from a moral one. This business is dominating us for the worst reasons in the space that matters most. They are the biggest driver of what is making it harder for people to live a life worth living. And they're supposed to be in the business of making life better. So let's bring in lawmakers, both sides. Both of their plans today went down in the Senate. Neither one is in the Senate. But this is their problem. Let's see if they disagree with me. I'll tell you what, part of me, I really hope they do. Democrat, California, Representative Sam Liccardo. Indiana, Republican, Representative Marlin Stultzman. Gentlemen, first of all, thank you for doing the hard part. Thank you for coming on together. I appreciate you both very much for doing that and showing the audience we don't all have to act like savages all the time. Would either of you like to say, no, I have it wrong, the costs come from something else? It's not about what I just laid out, that it's not about a cost structure from a business that has just dominated our process.
Well, I'm not going to take any issue with that fundamental fact.
We agree.
Go ahead, Marlon. I'm sorry.
Go ahead, Sam.
So we agree.
Ahead, Sam. No,
we'll make this is easy. We all agree. Good. Let's go to yes. What can be done, because neither plan that was put up today. Yeah, neither plan put up today in the Senate, not you guys, but subsidies, we obviously need them, but we need them for the wrong reason, okay? You want to give me a health savings account? Great, but that doesn't change how much I have to pay for things. So, I'll start with you. Sam, you tell me, what's better than what we got right now?
Well, I put together a bipartisan bill, the Fix-It Act, that would focus on going after some of those cost drivers. Insurance companies, for example, on Medicare Advantage, that are driving up enormous costs from taxpayers through what's called upcoding. So we need to reform that process in which those insurers get compensated by the government, and going after some of the insurance brokers who are making a lot of money fraudulently signing folks up without their knowledge. With those measures, we're actually able to more than pay for the extensions of the ACA tax credits over the period, and that's why 6 Republicans joined me with 5 other Democrats on the bill. The problem, of course, is that bill's not going to get to the floor.
Marlon, what do you think about the idea of Medicare for all? What bothers you about it?
Well, Chris, I would say that that really takes out the free market aspect of healthcare. There needs to be some sort of competition in the marketplace. I mean, let's look at, you mentioned, if you go to the emergency room, and of course you're not going to be asking, what is my price going to be when your son or your daughter has a broken foot? You want to get treated. Well, the problem is then you get the price a couple of weeks later, and that's when you get the sticker shock. If you did the same thing with an automobile, and you took the automobile home, and then they sent you what you were supposed to pay for the car, and it's way more than what you ever would have expected to be, you're going to take the car back. But you can't do that with our healthcare system. I think what's the problem is, Chris, is that there's too many hands in the cookie jar. I don't disagree with you one bit, other than I do think that health savings accounts is a short-term fix. It's part of the answer. I guess I just don't have any sympathy for the insurance industry, because their profit since Obamacare passed is 400%, over 400%. The insurance companies are making a boatload of money. off of the taxpayer,
Right.
as you mentioned, through subsidies. And then they're hiring the doctors out of the industry to come over and work at health insurance companies to set the prices, and they're negotiating back and forth. So the overhead of healthcare is way out of control. There's simple systems that we could put in place, I believe. It's not an easy fix overnight. That's why it's going to take us some time. And there is a political liability, because if it doesn't go well, as we saw the Democrats, had to deal with that back in 2010. It is a very complicated issue right now, but we need to simplify it.
Well, you need to simplify it, but I mean, even in the explanation of it, it gets very tricky very fast. You say you want more competition, but everybody's pricing it to the locality. So you can put money in an account for me and let me go shopping. Instead of in New York, I'm going to get it from an insurer in Ohio, but guess where they're going to price my policy from? My catchment area, wherever, that's where it's getting priced from. And they don't want your sympathy, right, Marlin? They want your fealty. And if you don't do what they say, they're going to run somebody against you and fill up their coffers with PAC money, and you're going to have your hands full when they start threatening jobs in your district. They have it a lot of different ways. Now, I can look at the data, Sam, and the ACA worked out well for Democrats. It got more people access to health care. It was never supposed to be, it should have been called the Accessible Care Act, not the Affordable Care Act, because it was about expanding it, and the hope was that states would pick up on the Medicaid waivers, and they didn't. So, the red states didn't want it to be what it could have been. But we still have the cost structure problem. The beauty of Medicare for All, from Bernie and others, is the government will tell the corporations what they can charge. Are you in favor of that?
Well, if somebody can figure out a way to pay for it, I'll find a way to support it. But fundamentally, we have a system now, far from perfect, as you have clearly pointed out. But we all know that healthcare costs were skyrocketing before we had the Affordable Care Act. That's exactly why the Affordable Care Act was put into place. This is not a new problem. Yes, there's a lot of interest groups that make a lot of money off the complexity and the disaster that is our healthcare system. There's no question about that. But to attribute it to the Affordable Care Act, I think, is wrong. I think Affordable Care Act has enabled us to dramatically reduce the number of uninsured in this country by nearly 20 million people.
True.
And that is critical,
True.
particularly with the subsidies that help folks who struggle with everyday costs.
Here's my last question for you guys. And again, I'm not putting you on the spot. I love having you on. You're always welcome here. How are you going to test this when on your side you got the Speaker of the House got $1 million? You got Hakeem Jeffries, he got $1 million. Thune, he got $1 million. Schumer, he got $1 million. They're not going against the guys who gave him the money. I mean, when does that ever happen? I mean, you can say, well, everybody gets the money, so we're all on an equal playing field. I mean, Marlin, do you know anybody who's got more juice in terms of leverage with government than these healthcare companies?
No, I don't. I mean, it's a very powerful lobby. It's a very powerful industry. And partially because there's confusion, especially with the consumer. The consumer is the one holding the bill at the end of the day. And as you talked about medical debt earlier, it's because people can't plan for a visit to the hospital, and all of a sudden you got to do a bypass surgery, and then you get the bill for that. And you know what? There's going to be cases like that where we have to set aside, that sort of operation to be able to be paid for, because it's an exorbitant amount. It does cost, but at the same time, a lot of our routine visits to a physician, those should be very simple. Let's try to, the liability that also comes with healthcare is exorbitant as well. So again, I think there's too many hands in the cookie jar, as I said earlier. People see that's a place to make profits, because there are a lot of government dollars that go into healthcare, and they're going after those dollars because they see it's an easy place to profit. The bottom line is obviously.
Go ahead.
Well, I was just going to say that there's too much focus on the bottom line rather than focusing on the cost. And I think that we have to drive costs down through competition. I've got a hospital system in Fort Wayne that they're one of the highest cost providers in the country. This is Fort Wayne, Indiana. We're not a high-cost state. Well, we've got a hospital that's going to come in and compete with them, and that's what they need.
Good. Look, that's great. You can have competition, but it comes down to who gets to set the cost structure. And that's the beauty of Medicare for All, right? Is the sell proposition on that is the government says this is what you can charge. had been working better for Medicare, but now that's starting to change also. Gentlemen, I appreciate your candor.
And Chris,
we'll keep talking about this. Go ahead, Sam. I'll give you a last word. Go ahead.
Yeah, just if we're going to talk about competition, let's be clear. Over the last quarter century now, we've seen more than 2,000 hospitals in mergers. We're getting less supply, not more supply. That is fundamentally a core issue.
Yeah, because they're consolidating their wealth, and it's working really well for them. Sam Liccardo, God bless. Marlin Stultzman, God bless. Do the work of the people. I know it's hard, especially on this one. I would not want to be you guys. 4 minutes and 35 seconds. All right. Something that is a worthy distraction, okay? Charlie Kirk's assassination should have been a moment for all of us to really think about how we practice our politics. But it wasn't. People just doubled down on their own side. And now we had the guy who's responsible was in court today. It should be a non-event, but it wasn't. Why? Conspiracy theories. Conspiracy theories. And I want to take a look at what this is doing to the political right. Even with Erika Kirk coming forward and saying, stop playing this game with my son's assassin, with my husband's assassination. I want to talk about that, and I want to talk about what's working in politics for which side and why with two people who know the game. Next. "22-year-old Tyler Robinson assassinated Charlie Kirk. Period. There's no reason to believe anything else. But there's a cottage industry, especially on the right, cashing in on conspiracies about the murder. It has divided MAGA in a way nothing else has, even though there's nothing to it. Is this the line? Has the fringe on the right gone too far? And second question, is affordability the ticket to the midterms that I believe it is? Joining me now, better minds, conservative commentator Scottie Nell Hughes, progressive YouTuber Brian Tyler Cohen. Good to see you both.
Good seeing you, Chris.
So, Scottie, what's your take on what's happening on your side of the ball with this? There is no good reason to believe it was anyone else or anything else. Even the widow is out there asking Candace Owens to stop making a fortune, destroying her husband's death legacy.
Chris, while all of this is extremely disappointing, it's not surprising. I mean, we're talking about Charlie Kirk, who was probably the key principle, the key foundation of a movement, but he was also CEO of an almost $2 billion company. And so with his absence, what you have seen is blood in the water. The sharks are circling. They see the instability that's happening within the organization, and they're wanting to go back after many of them reclaiming some of those donor money that Charlie was able to accumulate over these past few years. Extremely sad, extremely disappointing, but you're also talking about a movement that has been built in questioning everything that's happening across the board, including Turning Point, questioning the government, questioning law enforcement, questioning the findings. So it should be of no surprise that they're questioning everything that's going out here. And unless you can come out with solid answers and transparency, these questions are going to continue. And unfortunately, so will also the division.
All right, so this is the distraction. The focus should be affordability. That's really what Trump ran on, was gas and groceries, immigration too. Now, Brian and I have crossed swords on the idea of, Brian will say, I'll speak for him, why not, it's my show, we can do two things at once. We're going to fight the state of play where it stands in the news cycle that day, and we're going to fight the bigger picture things. Fine. On this affordability tour, why don't the Democrats have a competitive tour around the country with solutions for what the president seems very ready to ignore?
Look, they don't need to have some competing tour around the country. They've got candidates doing their thing on the campaign trail. But I mean, Donald Trump's tour in and of itself is going to stand alone as this humiliating ritual that it is. I mean, the notion that this guy is going to go in front of the American people and run some self-congratulatory tour about how he brought prices down when everybody's prices on everything are going up, when the price of housing, of rent, of food, of electricity, of energy, all of that is going up right now. They've got full control of government. Republicans control the House, the Senate, and the White House, so there's no Democrats out there to blame. Everybody can feel it. It's the same problem that Democrats contended with in the lead up to 2024, which is this idea that you're just going to tell people the prices are lower even though they're higher. So if Trump wants to go out and try and, rewrite history and convince people of something that they're not feeling, Democrats don't need to interrupt their enemy while he's making a mistake. He's got all the power in the world. Let him go and try to do that.
It is unusual for Donald Trump to be off on feel, Scottie. And, we all know what you can do with economic data. You can make it look like whatever you want. People feel prices are up everywhere that counts. How do you think about, is he playing this the right way?
Well, I think obviously empathy goes a long way, especially in the economy that we're in. And we have not even reached the 1-year mark of President Trump being in office. And a lot of the issues that Americans are facing right now are a result of the past 4 years of the Biden economy. When you're talking about Green Deal regulations that made our car prices go $1,000 to $2,000 higher, soaring credit card debt because people couldn't pay, not because of just this year, but because of 4 years, 8 years, 10, 12 years of accumulating debt, high interest rates that are finally starting to come down. But I agree with you. What we need to be doing, the Republicans have got to be focused on a clear, concise message. They do need to talk about that gas prices are lower. You're talking under $2 in Midwestern states like Oklahoma. You are talking about how you are seeing prices reduced at the grocery store. But we also went through 4 years of this call for this raising of the minimum wage. Guess what? Those trickle-down costs are now starting to be felt by these type of products that consumers are buying. Those are the messages that need to be pushed and to say how we're going to combat those prices in the future.
Raising the minimum wage is not
wild.
why we have the price problems. But Brian, last point to you. Go ahead.
I mean, I just diagnosed the exact problem, and my fellow co-panelist here just fell into the exact same trap of telling people that everything is great. People out there who are watching right now know everything isn't great. And frankly, the idea that we can blame people, I mean, the idea that we're blaming people making minimum wage is crazy right now. First of all, the minimum wage wasn't raised. It's still $7.25 an hour. And the notion that all of these people at the top are consolidating more wealth, more power, more money, more influence, and that we're looking at the people at the bottom of the tax bracket and blaming them is the entire
I'm not
problem
blaming anyone.
to the full GOP.
I didn't blame them. I just told you why the costs were rising, and we need to put the
costs are not rising because minimum wage workers are getting paid minimum wage. Costs are rising because Donald Trump is engaged in a trade war right now that is raising the cost of everything. And it's because all of these legislative bills that are passing, these tax cuts overwhelmingly favor the rich. And it's that exact mentality of blaming people on the bottom
that's the problem.
That's causing all of these Americans to vote Republicans out of office right now.
Talking points.
Oh, look, I'll tell you what. Listen, you got to have the right talking points on this one because I'm telling you, I hope I'm right about this, by the way. If the midterms are decided on how people feel about affordability and what's being offered them, that'll be a fair election. I hope we're not distracted by something else. It's hard because it seems to me both sides would rather talk about other things, and I get why. Brian Tyler Cohen, good to have you. Scottie Nell Hughes, it's been too long. Always good to see you. Always good to hear your arguments. We'll do it again soon. 4 minutes and 30 seconds. So there are new calls, speaking of distractions, to audit the Epstein files. Look, they know the answer to this already. We gave you the answer to this. There is a con afoot. And I hate this for the survivors and the people who deserve clarity. But we know what's happening here, and we know why. And I'll tell you right after this. We're a week from release of the Epstein files, and a group of survivors working with the Senate Judiciary, Democrats, wrote a letter saying, hey, we want an independent review. We're worried that documents may have been tampered with, the chain of custody. Look, I feel for the survivors. They deserve the clarity. There's no way this was about one man and one woman and nobody else knew anything. But we all know the answer to this. Let's bring in former FBI Special Agent and CIA Officer Tracy Walder, because I had her on the show to give you the answer to this. You told me on this show, my friend, you've never heard of this big of a redacting operation going on. That's the answer to the question. They are absolutely going to have reason to say, wait a minute, where are these documents and how come I can't read this? I mean, is there any chance that this is satisfying?
In my opinion, Chris, no. And I agree with you. This is, in my opinion, all about the victims and what I believe that they deserve, which is clarity, just like you mentioned. And yes, I do believe that redactions are important for ongoing investigations, protecting the names of minors, those kinds of things. But we've talked before, these redactions were completed in March. So why don't we know about them now? Why have they been held onto for so long? And I think that plants these seeds of doubts, and rightly so, in the victims and in everyone else's mind.
What ongoing investigations, though, Tracy? They're not going after anybody else.
I don't know. I don't believe that they are going after anyone else, but I don't know if there's other financial crimes that they're looking at and those kinds of things, because things like that can come from these investigations. I doubt that they will, but again, I'm not certain in this case.
Where's your head on this? So Thomas Massie says that he was given a list, Representative Thomas Massie, for you guys at home. Tracy knows everything. He was given a list of 20 alleged co-conspirators, let's call them. These are men and or women who knew. Not that they did things, but they knew things about what was being done to people. There is, in my opinion, zero chance that that list comes out, because if it is anywhere, it's in the depositions that were sealed by federal judges in the civil cases, which is not part of the Epstein files, and people keep not being told that. If it doesn't come out in the release, which again, I don't think it can, do you think Massie has a legal duty to release them himself?
That is such a hard question to answer, Chris, because you're right. They are sealed from those civil cases. I personally, not as an FBI agent, I personally believe that he does have a duty to release those, because those are individuals that could have been involved in child trafficking, in pedophilia, those kinds of things. And I do think it's in the public's best interest to know that information. But from a legal standpoint, I'm just not sure if he can.
I think that legally he's going to have a problem, but morally he should be willing to pay that price. They're always talking about what hill to die on. If not this one, which he should have never said he had the information if he didn't want to make it public. Tracy, you're the best. Thank you for just making it plain to everybody so they know where we're headed. 4 minutes and 15 seconds. Every day, journalists around the world put their lives on the line. I got to tell you something. I'm not a huge fan of people in my business writing books where I'm like, yeah, I did the same thing. But I like this one that I'm going to tell you about. And it's not just because this kid is part of our team here at NewsNation. I've watched Robert Sherman do the job. And he reinvigorates passion to do it the right way. Okay, he's been at NewsNation for years. I was with him in Israel. I've seen him report from Ukraine. He does the job the right way for the right reasons, and he wrote a book about what he's learned, and I want you to hear it from him. Great guy. Next. So Robert Sherman landed in a war zone just after he started at NewsNation, and he was our guy in Ukraine. I wasn't even here at the time. And then he was our guy in Israel watching the battle with Gaza, and I got to watch him work there after October 7th. He even got access on the ground in Gaza to meet with refugees. Really important part of the story, and it's still Israel's biggest mistake, in my opinion, not letting the media in there even to this day. So he wrote a book about the lessons that he has learned from these missions. And it's out today, called Lessons from the Front, a rookie war correspondent in Ukraine and Israel. And he joins me from Puerto Rico, where he's on assignment, as he always is. It's good to see you, my man, my hero. So what do you want people to learn from your book?
Thank you. I think the big thing for me, Chris, is that I was just 25 years old when I first wound up in Ukraine. That was the day that my life changed forever. I was so sure that I had an understanding of the world. I was just in college a few years earlier, did well in school, read a few books. I thought that I understood what was happening. It took me about 1 hour in Ukraine. The second that we saw all of these Ukrainian refugees walking 30 miles through the snow to escape and survive, that I realized I was naive to the complexity of the world. And so this is an account of the early days of after October 7th and the invasion of Ukraine. It's a human-first account in which you're going to meet everyday people and show you what the horrors of war bring. And I emphasize here, Chris, I've spent the majority of the last 3 years overseas I'm not coming back to the United States with really any answers about the world. I don't make any arguments in this, but what I do come back with the United States with is just a sense of gratitude. Gratitude for family, gratitude for time for loved ones, gratitude for growing up in Northeast Ohio, gratitude to NewsNation for providing me with this education in the world, gratitude for the passport full of stamps that I have, but most of all, the front page of that passport, which says the United States of America, because I just had no idea how good we had it. And that's my hope that people take away from this, that the world is complex, but I'm very proud to be an American and for everything we have here.
What do you think the biggest surprise in your experience has been so far?
I think the biggest surprise for me is just how different the world can look when you are looking people in their eyes, as opposed to looking at it from a 40,000-foot view. It's very easy for the world to look black and white when you're reading a textbook or you're looking at maps from above. But when you meet people face to face and you hear their perspectives, and you meet Ukrainians who don't know if they're ever going to be able to go to their hometown because it's been invaded, or you meet Israelis sitting in a bomb shelter who don't know if their loved ones are alive, dead, taken hostage, all of a sudden the world just looks so different. And that's a big message that I have here, is just how complex this whole world can be.
Well, you're a beautiful guy, and you do the job well, and you do it for the right reasons, and I love being on your team. Lessons from the Front, Robert Sherman, his first book will not be his last. I'll see you soon, my friend.
Thank you, Chris.
Be well. We'll be right back. All right, Leland Vittert takes the baton right now.
Me? I thought I had another
On
15
time.
seconds. Okay.
No. I'm changing my ways. I'm changing my ways.
All right. Chris, good to see you.